It has been well documented that as one's education level rises, one's income also rises. For that reason alone, we should encourage continued education beyond high school. But it has also been estimated that 245,000 deaths a year in the United States are attributable to not having a high school education, and that over 1 million deaths could have been avoided between 1996 and 2002 if all adults in the United States had a college education. These data underscore the fact that education is a major contributor to health in our society. As education levels rise, the chance of being healthy also rises. Education is a predictor of economic and physical and mental health. That's why Minnesota's Office of Higher Education is so important to the future of our state. We're going to talk about the work of that office on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at the work of Minnesota's Office of Higher Education. The mission of this office is to advance the promise of higher education to all Minnesotans and provide the critical information that guides decision about accessing higher education. The office provides students with financial aid programs and information to help them gain access to post-secondary education. The agency also serves as the state's clearinghouse for data, research, and analysis on post-secondary enrollment, financial aid, finance, and trends. It administers up to $150 million in needs-based grants to Minnesota residents attending eligible institutions in Minnesota. Joining me in this discussion is Larry Pogemiller, Commissioner of the Office of Higher Education. And prior to his appointment as Commissioner in 2011, he served as a state senator for 30 years, representing the district that included the University of Minnesota's main campus and Augsburg College. Larry, welcome to our program.
Thanks for having me, Ed.
And thank you. I've spent many years at the University of Minnesota, so thanks for all of your work on higher ed as a senator, but also now as the commissioner. So let's just talk about the benefits of post-secondary education. I mentioned a few.
Yes.
You know, it's got health benefits and it's got economic benefits. Tell me a little bit about your view of why people should think about post-secondary training.
There's actually been quite a lot of research about this, and you know, I don't want to jump to causal effects here, but you know, you're about 30% more likely to exercise regularly if you've got a post-secondary degree. You 15 to 20% less likely to smoke. Your ability to have health care coverage is much higher if you got post-secondary degree. So again, I don't want to be totally causal about that, but there's a lot of evidence that the more education people have, the healthier they are, and the expectations they have for a healthy lifestyle in their later years is much higher. Mm-hmm. So those are all good things. Mm-hmm.
So do you, in your office and in general, encourage students to go beyond high school for training and education?
We do. Minnesota has a relatively high economy in terms of the types of jobs that are available. And so we're really moving to kind of a universal post-secondary educational time of existence in Minnesota's history, where something past a high school diploma is pretty necessary to get the kind of jobs that are available in Minnesota. In most cases, not every single job is that way, but you're getting more part-time work for people who are not post-secondary educated. If you're post-secondary educated, particularly in the healthcare fields, there's more emphasis on RNs versus people just taking care of patients who have just a high school degree. And so we think it's in everybody's interest, it's in the economy's interest, and obviously in the individual's interest to get more education. The more the better, with the caveat that on average it works. You know, you don't want to ever tell somebody that for sure if you get a associate's degree or an RN or a doctor's degree, your life's going to be wonderful. Not necessarily true. There are other factors, obviously, but the odds are much, much higher that you'll have a lifestyle that you enjoy and the financial wherewithal to take care of your family. Mm-hmm.
And so are students making those decisions in greater numbers to go on to post-secondary training?
They absolutely are. Minnesota's on the high end of the number of people who actually get a post-secondary degree. And it's not just attendance that's important. It's important to get a credential or a degree. That's where the kind of earnings power kicks in.
And one of the things, I know you have the Office of Higher Education and we have a Department of Education. And I want to explore a little bit more about that. And I got a little slide that shows sort of a trend from early education to post-secondary. So explain a little bit about how you interface with the Department of Education.
Well, under the Dayton administration and on previous administrations, there's been an emphasis on trying to holistically think about people's entire educational cycle in their life, from early childhood through going back and recycling into education when they're in the workforce. And so as this chart shows, you've got increased investment in pre-K, because we think that readiness in terms of brain development, there's a lot of medical research on this now, that if someone is prepared and given the right foundation prior to kindergarten, they're going to do better in school throughout their life. And so Brenda Casilius in the Department of Transportation deals with the K-12 educational system. Our office deals with the University of Minnesota, St. Thomas, the for-profit colleges, MnSCU system, and we try to encourage those systems to be relevant to the workforce, which is the last piece of it, that if you get a decent post-secondary education, you are going to have a job that you find fulfilling, interesting, and that we hope pays the type of money that allows you to pay back your student debt, as well as pay for a good lifestyle for you and your family.
So the Department of Employment and Economic Development, DEED, I mean, probably sees your office as a major contributor to economic development in the state.
Yes, they're more and more becoming kind of a seamless development of policy across early childhood, K-12, post-secondary, and employment agency. And we're actually creating something called a statewide longitudinal educational data system, that we hope to combine data across these delivery systems and start to talk to people about what are the things that actually work and don't work in terms of a nice pathway for education and work that is productive, affordable, and something that the state can encourage people to do. For example, if you're ready by the time you get into kindergarten, the odds are better that you're going to do well in elementary school. You're going to read better. If you take the right kind of academic things in grade school and high school that lead to post-secondary interests that you have, then you kind of shorten your pathway, and there's less kind of time spent on activities educationally that don't fit into either your aspirations or your ability levels.
Yeah, and I was going to later on talk about the SLEDs, the longitudinal educational data. Tell me a little bit more about that and what that could accomplish.
This has been an effort across the nation. For people who work in private companies, they talk about big data. They spend a lot of time trying to analyze what their customers do and why they make various decisions. The government or the public equivalent of that is to kind of study what kind of outcomes we get with public investment in terms of people's success. And so we are trying to take what's a person's pre-K experience, their K-12 experience, their post-secondary experience, and how does that then show up in the workforce. And we hope to kind of enlighten and help people understand which types of things are most productive, most useful, and also get people to start worrying about things that maybe are not as productive. A simple example is there's quite a bit of work being done now on what should be the pathway of mathematics study as you go into the workforce, because the old model was everybody takes the same sequence of mathematics courses. And I think there's emerging evidence that for some types of employment, you don't need the same kinds of mathematics that you might need for other types of employment. And so allowing people to match up their educational experience with what their employment aspirations are should create both a less frustrated student and a more productive student. Because we know from research, and it makes common sense, that if you enjoy what you're studying, you're going to do better. And so we're trying to eliminate, kind of in common sense terms, we're trying to eliminate the fields of effort in education that people don't find relevant to their own experience, because they tend not to do well in those areas.
It sounds like this data set will actually take us from the old model of education built around an agrarian model to actually built around a modern 21st century economic education model.
Absolutely, and the idea here is it should allow us to have a more personalized approach for each learner, because it'll take away a lot of the inefficiencies and a lot of things that learners find frustrating about their experience. And the research is really overwhelming, that different people learn different things at different times in their educational journey. So we should stop trying to force a particular type of learning onto somebody at age 7. when that's just not the moment in their life that they're going to be learning that. And we need to be much more adaptable to people's learning styles. And it'll make for more productive learners and a better use of people's financial resources in education.
Good. Well, I want to talk about some of the specific activities of your office, but first we need to take a little break. We'll be back right after this message.
The next word is procrastination.
Can I have a definition, please?
To put off or delay action.
Procrastination.
Need to start saving for college? Minnesota has a 529 plan that makes it easy to start and easy to save for your child's future college education. Minnesota's College Savings Plan. After all, it could come in handy. Learn more at mnsaves.org/spelling.
Michael Adams?
Here.
Michael Adams?
Here.
Michael Adams.
Michael Adams.
Students who miss 18 days of school in any grade risk falling behind and not graduating. Absences add up. Keep track at boostattendance.org today.
Welcome back. We're talking about the activities of the Office of Higher Education in state government, and we're discussing this with the Commissioner of the Office of Higher Education, Larry Pogemiller. Larry, in terms of talking about the benefits of going on to school, should everybody go on to post-secondary training, or should they go on to college? When families ask you about that, or communities ask you, what do you say?
I think the answer is yes, in your lifetime. Whether you need to go immediately after high school, that's a question. But I think the way the economy is now, almost everybody is going to need some kind of post-secondary credential during their lifetime. And so I think the way to think about it is it's a lifelong journey. And when you choose to access post-secondary is something that may differ for various families or students. But as a public policy, we should make it available financially for everybody at whatever time makes most sense for them. The number of adult learners has gone up dramatically in the last decade, and I think that it appears that trend will continue.
When you talk about credential, tell me what kind of credentials are out there, because people know about the bachelor's degree and the master's degree, but what are some of the other credentials that people can actually benefit from?
Right, people think of associate degrees, which are 2-year degrees for various professions, but then there's also credentialing for particular jobs. We still do think about it in terms of apprenticeships for machinists or welders. So those are things that are post-secondary credentials, and people should think about. What we do know, though, is that even if you go for those traditional credentials for what people used to consider just blue-collar jobs, because of the significant increase in the complexity of technology, those workers also need what we historically have thought as liberal arts educations. They need to be able to critically think, they need to be able to adapt to change, they need to work in groups. And so what we hear from employers and what the research is indicating is every level of occupation is kind of getting a broader set of tools and skills that are necessary for it. Even the chemist who historically get their PhD, the type of equipment that they're using in their laboratory is getting much more complex. So the blue collar aspect of their own job is even more complex than it used to be. So on both ends, we need broader sets of skills, more liberally artsy types of skills, critical thinking skills, and more specific technical skills because of technology. Regardless of whether it's a associate degree or a PhD, you still need some very specific skills, otherwise employers can't use you. They'll find somebody else who has that specific skill.
Yeah. So education is changing dramatically.
Yeah, it's not two groups where you have kind of the liberal arts baccalaureate track and then the blue collar track. Yeah. It's becoming much more interspersed and much more complex for all of those types of learners. And we look at a country like Finland that has created a system where there's a much easier way to flow in and out of what type of education you need during that particular part of your career. that I think should start to emulate. It's not same as a tracking system that we historically think of Germany and some other countries where you pick, I'm going to be a baccalaureate or I'm going to be a blue-collar worker. Finland has, in the last 20 years, devised a system that says, no, you're going to come in and out of both of those types of educational activities. And so we need a system that allows that flexibility in terms of its design and in terms of its financing.
Mm-hmm. So do we have a system that works that way?
We're moving that direction. I would say we don't have it yet, but you hear Chancellor Rosenstone at the MnSCU system and Brenda Casilius in the K-12 system talking a lot about pathways between 9th grade and 14th grade. Mm-hmm. And that is about what types of math courses should you take during that period to lead to what kind of either educational result you want or employment result you want during the short term, during the next decade, which is different than saying you're picking for the rest of your life which path you're on. Mm-hmm. Because there's just a lot of evidence that a lot of people pick kind of one kind of path early in their life and end up later going back for more education or different education, a different master's degree or a different certificate, so that they can enjoy a different kind of work environment. Mm-hmm. And you see that with all levels of education now. And I think that's a good thing. I think it's going to lead to a more robust lifestyle for many, many people.
Yeah. Well, and you talked about MnSCU, and I've got a couple of slides here to show where the, high school students are going. And the first one just shows the 45,000 high school graduates where they went to in 2010. And most of them stayed in Minnesota, and the community, and a lot of them at the community and technical colleges.
Yeah, most do not go immediately on to a four-year degree. There's a lot of that 12,000 that ultimately, after 2 years, will transfer to a four-year program. But most people do not start at the traditional baccalaureate.
Yeah, and then an even number go to the MnSCU schools and private schools and University of Minnesota. Equally divided. What sort of choices are involved in that kind of decision?
Again, it depends on what a person's aspirations are. But you can see the only out of that old group, the only group that has kind of open enrollment are the community and technical colleges. Every other, the state universities, now have kind of requirements for academics in terms of GPAs and in terms of either SAT or ACT scores. University of Minnesota has controlled enrollment, all the private colleges. And even now the private career colleges or for-profits, mm-hmm. they actually control enrollment a little bit based on inputs, based on your educational background or work experience. Mm. So out of that whole group, the only group that is truly open enrollment are the community and technical colleges now. Okay. And that's because we believe there should be universal access to post-secondary education.
Well, then the second slide shows, the other group that leaves the state, 18%, and naturally they go mostly to states around Minnesota, but still 9%. And what goes into that choice?
They do that sometimes for financial reasons. For example, an engineering degree at North Dakota is less expensive than an engineering degree at the University of Minnesota. And presumably that student is making a financial quality decision. Which mm-hmm. one do they think works best for them? We have tuition reciprocity with adjoining states, Wisconsin and North Dakota. And then there are some students, always has been, who just choose to be somewhere other than their parents. And so, they'll go to the East Coast or the West Coast, and that's historically been there, but it's roughly around the 25% range, and there's nothing wrong with that. Minnesota, by the way, we should be proud of, is basically a brain magnet. More people come to Minnesota after their education than leave Minnesota after their education. And that's both the quality of our workforce, but I think the quality of our post-secondary institutions too, because if you get people from foreign countries or other states coming to the University of Minnesota or MnSCU campus, they tend to stay because they thought the quality of education was pretty high.
Mm-hmm. Yeah, that was one of the questions, if they go to school here, do they stay here?
They do tend to stay.
So it's in our best interest to try to educate Minnesota students here in Minnesota.
Absolutely. You have a set of campuses that are kind of national campuses, McAllister, Carleton, the University of Minnesota. They're like the Ivies in a sense. Mm-hmm. They do attract, and they want a certain group that's from out of state because they're trying to get kind of the high ACT scores. And we see the evidence is real clear. When that student comes to our state, they tend to stay.
Mm-hmm. Good. Well, I want to talk about cost, and I also want to talk about the healthcare workforce, but we need to take a break first. We'll be back right after this message.
So what you want to do is, have you already enrolled?
You're 25.
that just do?
Select the drop-down menu again. To
Wait.
site you're already enrolled.
Example here, so
Don't panic. You're ready to make your payment. Submit. There it is.
oh my God, I really can't believe it. That's awesome. Good for you.
Welcome back. We're talking about higher education with the Commissioner of the Office of Higher Education, Larry Pogemiller. Larry, we got a couple of big topics in our last little segment here, and one is just about cost. We've been hearing about the cost.
Yep. And it's true. Minnesota, for post-secondary education, Minnesota is on the high end. We're, in terms of debt levels that people take on for a baccalaureate, we're third in the nation. And we're fifth in the nation on the number of students who take debt. I think for families, the most important thing to realize is that post-secondary education has both a public good aspect to it and an individual or private good aspect. And so they need to plan for either taking saving money or taking out some modest levels of debt that would be paid off after you get into the workforce. It's just simply not the case anymore that somebody gets a totally government-paid post-secondary education. That almost does not exist in the country anywhere anymore. Mm-hmm. And so families need to think ahead, plan ahead, and we will do what we can from a policy perspective to try to get institutions to hold down their price as best as possible.
What percentage of the total cost of education is publicly supported? Do you know that?
Well, in Minnesota, post-secondary education is about a $7 billion enterprise, and about $2 to $3 billion, depending on how you add the money, comes from public sources. So the majority of the money actually comes from families and students themselves. Mm-hmm. It does not come from the public. And there are obviously, for low-income people and for lower middle-income people, there's Pell Grants, there's state grants, but even those students don't get paid their full cost of post-secondary education paid for. So almost every family needs to either put in some savings or some current income through working while they're in education. Almost every student works nowadays. For you and I, Ed, there was a whole group of students that did not work while they were at college. That has really pretty much faded away. There are some students who don't work when they're in college or post-secondary education, but most do now. Almost everybody works. And so it's changed quite a bit from the boomer generation. The price is higher, it takes more savings, and there's more debt than there was when boomers were in college.
All right, so let's finish up with talking about the workforce in health. I mean, health is 18% of our total GDP. Is that a growth area for education?
Yeah, the good news, if you want to go into healthcare, is that it is a growth area for education. There's in the last decade, there's been about a 25 to 30% increase in the number of healthcare jobs in Minnesota. The demographics tell you why. As we get older, there's more need for healthcare, and so healthcare is a great area to go in. About 10% of the total workforce in Minnesota is healthcare related, and the types of healthcare jobs are becoming higher tech, but also more dispersed. There's more opportunity for people to be, for example, public health practitioners, so that you go into people's home and help them so they stay out of nursing homes and stuff. So I think healthcare is one area where the opportunities are broad, interesting, and the pay scales are going up. The pay scales, I think having been in this area for years, are not where they need to be, but they're going up because of the economic pressures. One area where we're struggling, frankly, is that healthcare educators. The boomers are starting to retire in healthcare education, and so I think we're struggling a little bit to get top educators to go into the field of healthcare education. And so I think hopefully there'll be a market adjustment there to attract the best and the brightest into education of healthcare providers.
And are there new professionals that are coming up, with the changing healthcare system, less in-hospital and more ambulatory and home care?
Yeah, you've described it. That's exactly what's going on. And even nurses are getting higher levels of expertise. They're being asked to make higher level decisions because the most expensive aspect of healthcare is if you're working directly with somebody who is a doctor. Mm-hmm. And so we're looking for ways to have other healthcare professionals who can make decisions, who can help provide good healthcare at different pay rates, so that you can kind of fit the need to the expense. And as we all know, both healthcare and post-secondary education are in kind of economic models that are not sustainable. We cannot continue these price rises, and so that's why you see quite a bit of innovation in the healthcare area and quite a bit of innovation in the post-secondary.
Yeah.
We can't continue to pay the same way we have. People just won't be able to afford it.
One last thing is, you know, our population is changing. We're becoming much more diverse. How are you dealing with some of the diversity issues that are so important in healthcare, but also in education?
The obvious thing is there are language differences and cultural differences that healthcare providers have to adjust to. But a small item is that there are quite a few healthcare professionals immigrating here from other countries. And if we need to adjust our licensing and our educational system to allow those professionals to quickly transition back into the workforce as they come to the United States. A lot of that is language, but some of it also is there's different standards of healthcare in the United States. So if we can tailor our educational programs in a way that allows those professionals who have a real solid base of healthcare knowledge based on their previous work experience in a different country, if we can get them back into our workforce quicker, it'll be both better for them as immigrants, but also better for our healthcare system.
Good. Larry, we've covered a lot of ground. Thank you thank you for all of the work that you're doing in higher education. Such an important thing.
It's fun.
Good. And I'll be back with a closing comment right after this message.
Read to a child today and spark a lifetime of ambition.
On the wall at the entrance to the health service at the University of Minnesota is this quotation from Herophilus of Chalcedon, who was the physician to Alexander the Great. He said, "When health is absent, wisdom cannot reveal itself, art cannot become manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied." This quotation highlights the fact that health is central to and essential for a good education, which allows wisdom and intelligence to flourish. It also underscores the fact that health is of critical importance for most of all other aspects of our society that make our lives meaningful. And as we learn more about the importance of education to our health and development, a reciprocal quotation could also have been penned by Herophilus. It could have gone something like this: "When education is absent, health cannot flourish, lives cannot be long, disability cannot be avoided, potential cannot be realized, and contentment cannot be achieved." Health and education are like the yin-yang symbol. Both the yin and the yang, both health and education, are of equal importance, and they are interconnected and interdependent. Both are essential to form a full circle of life. The bottom line is, if we want to have a healthy society, we need to be sure everyone is well educated. And if we want a well-educated society, we need to be sure everyone is healthy. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.